Dear friends, in this episode of BG Dental Tips, I'll share with you tips and tricks related to master the proper positive profile during direct restorations of adjacent teeth. Stay in touch and let's go. Dear colleagues, sometimes it happens when you do, for example, diastema closure using composite material or adjacent class 3 or class 4 restorations or composite veneers, doesn't matter. And sometimes it happens that one tooth profile becomes progressive, one will become, let's say, negative, and the midline is really doesn't look nice, okay? So how to manage this, I would like to share with you during this small presentation. First of all, when we restore in the proximal context of adjacent teeth, we use sectional metal matrices, okay? So we put them together, we restore one tooth, remove one matrix, then we restore another one. So that way we may have more or less equivalent space for both of them. But sometimes it happens like you can see now on the screen. We have so-called positive and negative profile, right? So let's take a look. Here we have positive, here we have negative. So what to do if it happens? First of all, we will have to create enough space, okay? So we take a strip, metal or plastic, and probably you will create a little bit more space on the tooth that is more progressive comparing to one that has negative contact. Then I prefer to use wide celluloid transparent matrix, which I place to the tooth that I'm going to rebuild the interproximal contact. Then I use a composite packer. It has to be very smooth and soft and rounded instrument, and I will point on this matrix the contact point I would like to have in a future, okay? So this is the first thing, and then with a thicker part of the instrument I create a proper contact profile, okay, with the accent to specific level of this interproximal contact. So that's one trick. Another thing is we put it then on the tooth, okay? We provide re-wetting of the surface using wetting resin, okay? So we strip, okay? Then you place the strip, I mean the transparent, then you use adhesive, better to use unfilled or modeling resin, so you will re-wet the surface, buccal, proximal, palatal. For that we use a brush, okay, because it goes into this tiny area. Okay, then we dry everything completely, super dry, okay, then we polymerize from buccal, from palatal surface, and then next step we will definitely use a wedge just to create tighter contact. Wooden wedge in such cases work better. And then step one is to use highly filled flow restorative composite, for example general universal flow injectable, okay? So we just put it to the matrix, spread it with a thin instrument, and before polymerizing I take a packable composite straight away and I start to pack packable composite using thin instrument to the interproximal area until I'll be able to see from the palatal surface exposed composite, okay? So this is very important because the whole interproximal area has to be filled with a composite resin, okay? And by the way, don't forget to put like to this video and to share it with your colleagues and to follow us if you didn't make it before, okay? And then we continue. So we have composite there. Then I start to manipulate with the matrix, okay, by pushing the matrix into the buccal direction and incisal direction. Our composite follows the shape I would like to create. So basically we have to manipulate with this matrix in a specific manner, and that will help you to get exact profile you want. Then you fix it with one hand, another hand, and then you polymerize, okay? Then you polymerize, then you will make finishing and polishing. There will be some overhangs in a cervical area which you can manage with thin carbide board, with a strip, with a scalpel blade, whatever, and then we just polish this contact as we usually do for composite restorations using different instruments like silicone points. Then we go with spirals, with the brushes, and so on. So then you get better interproximal contact. If you made a mistake, in the previous steps. I hope this technique will help you to make your restorations better, your interproximal profiles better. And if you want to learn more about composites, different techniques, direct, indirect, semi-direct, on the front teeth, on the back teeth, I really invite you to attend our 2 days hands-on course here in our dental training center in Prague, which is international training center for dentists from all over the world, and you will get absolute hands-on about composites in all possible techniques, okay? And stay in touch, my friends, and see you next time with a new episode of VG Dental Tips. Stay tuned.